Hi everyone, this is Leanne and this is From the Heart. And today I have an episode that is a little heavy. It's actually heavier than any other episode that I've recorded. I am also speaking to a screen, so sometimes my wording when I re-listen isn't exactly perfect. Not that it ever is, but just giving myself the permission not to be perfect and to post things that are important to me. This is, called From the Heart because these are things that are important for me to speak of. I see gaps in the system and then I need to start a conversation about it. So today it's about the increase in mortality, maternal mortality rate that we are seeing recently in Canada over the last very few years. The rates for 2024 have not come out to my knowledge. Statistics Canada has only come out with 2023 latest, and it is increasing. Canada overall in my profession, so over the last 20 years, had been quite stable. It was a lot better than the United States at the beginning of my career. And then, some countries in Europe always fared a bit better. I will put some resources again in the show notes so that I don't have to memorize numbers by heart. And then those things can kind of change as well. So there's no point in kind of saying exactly what they are. So the other thing is that like the increase in maternal mortality has increased apparently so much that even in like little urban cities, the hospitals in those, and like, so where I live in Ottawa, we've seen an increase in just that population. So that could be like a bit of a fluke, but it's something that I've noticed, and that colleagues are speaking to me about, and that small institutions are speaking about the increase that they're seeing. The thing that I'm a little bit concerned about, but it might just not be accessible to me and to the population, is that I'm not seeing the big organizations speak about this. So the Canadian associations, whether they're midwifery or obstetrics, I haven't seen anything public. So those are things that I have questions about. I'm really not an expert in maternal mortality. I've never seen one. When I started practicing, I was going a bit around the globe, working in very, very low resources in India, in the northern India, so in Bihar, and then in Haiti, and I did not see a maternal death, and I never saw anything close to that here in Canada. So I'm not an expert, but it's something that I've looked at and something that I'm passionate about. And when I became a midwife, my mindset was I want to participate in the decrease in mortality, especially maternal. So it's something that I've always looked at. So just to give you guys kind of like a little bit of a synopsis of what I've seen over the years is the United States has had a high maternal mortality. It had the highest maternal mortality in the developed world. A thing that I have seen and was really concerned about in my practice was that medical legally, we would compare ourselves to them. And I'm like, why are we comparing ourselves to a country that has worse outcomes than us? It makes no sense to me. Thankfully, the maternal mortality rates have apparently decreased in the United States. They're getting very close to ours that are increasing. So So they are doing something right if they're collecting data properly. And honestly, most countries, and even in Canada, we are not collecting data properly. So if you look in one of my resources, it will show that Ontario has a higher rate of maternal mortality. I will just say that my assumption is because Ontario has a very good system when it comes to gathering data. I think that's why it's higher. So that's a question, not something that I know. Um, so, and everything that we look at is based on everyone's own definitions and ways of collecting data, which may very not well be perfect whatsoever. Okay, so let me see here. If you look at Google and ask what is increasing the maternal mortality, they're going to say that it's the demographic that's changing. And yes, it has changed, but it has not changed like significantly in just a few years. So it has over like a decade or 2 decades. Yes, like the amount of people that are older and having babies has changed over, a period of 20 years or 10 years maybe, but not just in 2-3 years. Something to look at. But I was working until 2023. So they also talk about obesity. That has, again, like everyone has gained weight during the isolation period of our lives. And so that has a little bit more significance to me. People with obesity are more at risk of things like DVTs and failed induction, potentially more risk with a C-section, and then an infection if they do have a C-section, or something that they need to be sutured for, but especially the C-section. So I will post someone's family story, a woman who did die 2 days after birth. She had 3 kids. That family has decided to share their story with us. She died of IGAS. IGAS is infectious group A strep. That is a flesh-eating disease. Personally, like, not that I was paying attention to it in the beginning of my profession, but later in my career, that was something that was being talked about. And so I wonder if the amount of IGAS is increasing. I'm hearing more people speak about it, even outside of the world of maternal health. So I am hearing of more people dying of it recently. Has it to do with isolation? I was hearing about it before 2020, so I'm not exactly sure, but maybe that is increasing. Maybe there could have been a lowering in our resilience when it comes to our immune system, with what we've gone through 2020, 2021, 2022. And so that might make us a little less resilient to things like IGAS. And then with what we've seen in 2020, there's been changes in the socioeconomics. Every time we step out of our homes, we see homelessness quite a lot more when you're homeless. Also, what you eat, and what you have access to, the help you have access to changes a lot. Survival, you change into survival mode a lot more. And there are more addictions, more mental health that can lead to suicide and that kind of thing. So I'm wondering, maybe, are we seeing an increase in maternal health due to suicide? So the other thing, because I saw a study that came out from Florida. I only saw the abstract, but it was suggesting that there was an overall increased rate of mortality for all causes if people got the Pfizer vaccine. It also looked at Moderna, which did say that there was an increase in mortality for Moderna, but it was especially true for the people who had gotten the Pfizer vaccine. So if we don't look at that, and I know people think it's very controversial, but if we don't look at that, if we don't contemplate that idea and we just shut it down, we are potentially limiting ourselves to increase, better outcomes and decrease mortality and morbidity and that kind of thing. So we do have to look at these things, no matter how controversial they are. No matter, big pharma. And the mRNA vaccine is a very different vaccine than the ones that we all got when we were children. So we do have to look at the short term, like what are the effects in 1 year and what are the effects in 15 years and what are the effects on the offsprings. This is a very different thing. It's a different substance. We have to look at these things. So these are all my questions around maternal mortality. I am speaking about this because I don't see discussions about this in the world of obstetrics, where there's proactivity. Yeah, that's what it is, where there's proactivity. So this is going to sound however it's going to sound, but I knew that outcomes were not going to be great when I left my profession in 2023. I just knew that in my heart. And now we're seeing the outcomes because we're 2 years out of that. And what I was seeing and what I have been seeing, because I had the proof in the pudding back then, was that the increase in intervention when it comes to induction and when it comes to C-section, the impact of induction on C-section and that kind of thing, has been increasing, and hospitals around here have all seen their C-section rates increase. So, and that's just one example, okay? That the C-section rates are increasing, and there is morbidity associated with those things, and then with morbidity comes mortality. So that's a really big question that we have to ask ourselves. There's a tipping point where intervention is there to help when the benefits outweigh the risks, but I think we've pushed it, and we are in the potential, in the increasing of adverse outcome based on the amount of interventions that we are doing today. We're not in the using intervention to reduce things percentage-wise, like the amount of intervention. We are using these interventions. We're very comfortable with these interventions now. So these are things to look at. I'm not saying that one thing is very specific. I'm just saying that we need to have a conversation, and this is one that is important to me. And hopefully this opens up the doors to having that, and having difficult conversations and sad discussions. I will also say to the listener, if you're not a healthcare practitioner, when we look at the amount of mortality rate, we don't look at it from a place of how many deaths have been happening in a year, but we look at it per population. So it's usually how many in 100,000. So that's kind of what we do globally. The other thing that I'm concerned about is that, there's these guidelines that are written, and they're very black and white, and we, as healthcare professionals, get them, receive them, they're new. We read the guidelines, we memorize the guidelines or the policies in the institutions that we are working with. We memorize them. We do not question them. We don't look at the research, the lack of research, the quality of the research. And so then it becomes these guidelines that are kind of like one size fits all for a certain population. So this is what we do with obese people. This is what we do with people of that age. This is what we do with that. And it becomes very yeah, just black and white, and there's less intuition. And at the very beginning of my career, for example, we did everything we could to not induce morbidly obese women, and now there is a guideline to say that we should by a certain time, um, when they are term. And so that you guys, I've been questioning things, and I believe that there is more nuance, and I'm not saying that we should not induce people who are obese, for example, but I do think that there should be more nuance, and that clients should know that when we start intervening on their bodies when they are obese, they have a higher rate of their bodies not responding to the medication, and then leading to more intervention to get their babies out, like C-section, and then increase in morbidity, right? Infection, DVT, etc. So, but that depends, because the person is different from another person who's morbidly obese, right? So, yeah, that's why I'm a big fan of just doing the things for yourselves to be healthier and to listen to your intuition. And I myself am learning to, regulate my nervous system so that I can advocate for myself as well when I see my healthcare professionals, which I do have to do for myself as well. And sometimes it's not easy, and sometimes it comes easier. And I do understand that I have more knowledge in the body, and uh, being a child-bearing aged woman, and being able to have that dialogue and really understand what people around me are doing if I need care. But so the things are, you can always ask more questions. You can always give yourself a bit about more time and say, okay, I understand what you're saying. Is there any more information? I would like to think about it and go home and make a decision for the next visit. Let's say you can always give yourself that, and speak to more people before you come up with your final decision. And make that decision from a place that feels nice and centered. I will say, so when I was taking care of my father who had broken his jaw, when I was gathering information from people, even the healthcare professionals in my family were kind of not understanding the whole picture, because I had not taken pictures of the X-rays, and so then it instilled more fear in us than we needed. So just when fear is there, that's like, it's a constant learning process for me, that when fear is there, I shouldn't be making decisions. So use your intuition when you're choosing a healthcare practitioner. And did I say this at the beginning of the recording? If you are pregnant, or you know someone dear to you that is pregnant, there's really no need to fear maternal death. It's not going to help you out in your laboring process. And so, like, there's no need for that. I'm just trying to open up dialogue, so that we can get the ball rolling and have an open discussion that is public, and so that we all know, I know, and my heart is satisfied knowing that people are discussing these things and having discussions that are controversial, and they're trying to change something. That's what I want to see. I want to see people that are trying to change something, and that we are using the stats in front of us, and we're using them properly. That's all I want. I'm really not here to instill fear in people. I really, really don't want that. This is why it's taking me a few months to do this recording, because I did not want to instill fear in people. But if I have the fear of instilling fear in people, then I'm not having open dialogue, and not posting things on my podcast and relieving my heart. So that was my purpose of this episode. Yeah. Okay. So I hope that everyone has a good day. There's going to be a few resources out there in, like, my show notes. maybe I should post my blogs from when I was in India and Haiti for interest. I was really young um, when I went, and I write um, for the reader. You do not need to be an expert to kind of to read what I have to say. I did see a lot more, and I have tried to forget about what was happening. So again, just read if you're interested. Don't read to search for what could happen, right? You are in a very different place in the world than Bihar and Haiti. So just consider that. Um, yeah. Okay. Have a good day.